I'm Dr. Leo Powers, and today we're going to talk about the hiatal hernia and the gallbladder cleanse. And the reason why I'm talking about both of them is because the hiatal hernia has to do with the stomach, and then the gallbladder, it drains into the first part of the small intestine, which is right after the end of the stomach. So sometimes the gallbladder, when it's clogged with sticky bile, it will give you a burp and reflex up and cause the stomach to go through the diaphragm. That's part of the reason why it's irritated. So I'll talk about the stomach first, the different things you can do for that. And so there's a chiropractic treatment that you can do that helps to pull the stomach down, and then there's some balances tied in with it. And then a lot of times the kidney reflex is off, and that ties in with the adrenal, and then the diaphragm is underneath the lungs, you know, where the stomach jams up through. And the diaphragm actually, there's a muscle that's attached to the diaphragm. It's called the psoas muscle. And so when the kidney reflex drops, it puts pressure on the psoas muscle that's attached to the diaphragm, and then the diaphragm doesn't fully expand and contract with the lungs as good, and so it's more likely for that stomach to jam up through there. So the liver and the gallbladder and then the kidney adrenal area, that's part of the treatment of SOT treatment, is you work on the kidney adrenal area, and then a lot of times they pull the stomach down, and then there is spinal adjustments to the thoracic area. That's right up in here, T4, T5. And then there's a home treatment where you take a big glass of water and then you bounce on a trampoline, and then you just bounce like this for about 10 minutes. And then what happens is the water in the stomach will gently pull down the hiatal hernia, so then the part of the stomach that's above the diaphragm will come down. And if you do that every morning, it gets used to being down. And then the other thing you could do, tied in with the gallbladder, is if you take some apple juice or applesauce and take some of that before you bounce on your trampoline, then that will help the bile to flow out. Because the bile, when you get more what is called malic acid, which is the sourness in the applesauce or the apple juice, that actually helps to break down the sticky bile, so it'll come out and then go into your intestine. And then you have to have a fair amount of high fiber food for that to be absorbed into, and then when you have a BM, then it comes out of you. That's basically how that works. And back to the stomach, there are other treatments for the stomach. One of them is if you pull down yourself like this, and then move your head to the left and to the right, and then forward and backwards, you know, a few times. You can do that, and then that'll help to pull it down, that you can do yourself. And there are other there's category 1, 2, and 3, and category 1 would tie in more with the part tied in with the gallbladder and the stomach. So if you have a category 1 cranial respiratory fault, then by adjusting that, that can help to take the stress off the stomach also. And so different people may need different amount of treatments, you know, related to it. And the other thing that helps the stomach is there's a herb that helps the stomach to heal. Even if you have a stomach ulcer, they found out that, the herbalists found out that if you use, it's called comfrey, and you can get the plant and it'll grow, and the leaf will, it's kind of a green leaf, and you just eat it, and then it helps to heal the stomach ulcer, and it'll go away. And then the FDA, they found out that works really good, and then they didn't like people getting better with herbs, I think. I don't understand it, but anyway, they outlawed the use of selling comfrey in the market. You legally can't buy comfrey. But you can buy the plant and then just grow it, and then you can get your leaf and you can eat it. So that's another way to help to take stress off your stomach. The other thing for the gallbladder, there's a gallbladder cleanse that you take a quart of apple juice a day for like 5 or 6 days, and then on the 6th day you take like a grapefruit, citrus fruit meal for lunch and supper, and then you take this supplement. It's called disodium phosphate, and you take that with some warm water, and then before you bed on a Saturday night, then you take a half a cup of olive oil and a half a cup of lemon juice or grapefruit juice, and then you lay down on your right side or left side, it's on the instructions, and then with your knees up for about 20 or 30 minutes, and then that causes the bile to come out. And then a lot of times people that have done it, when they have a BM, they notice that there's little soft stones that are kind of light green colored that come out of them, and then they feel better, and their digestive tract feels better, their sinuses feel better. They usually feel better for weeks or maybe months afterwards. So this is another treatment that can be done in conjunction with chiropractic treatment and the stomach gallbladder treatment. So this is what you can do. I'm in Plover, Wisconsin, right here in central Wisconsin.